Ever wonder why, despite all of your efforts to stop your body-focused repetitive behavior, you continue to struggle with it? Let's look why that might be and what you could do to break the cycle. First, let's look at the biological influences that set the stage for developing a BFRB. Genetic predisposition and other factors such as hormone levels, sleep, nutrition, and exercise may set the stage for BFRB symptoms. Now, let's look at your ABCs. A is for antecedents. Antecedents are cues or triggers for behavior. You can remember how antecedents may be influencing your BFRB by using the acronym SCAMP. S is for sensory. Notice any sensations involved in searching for a target or in triggering the behavior. Ask yourself, do I notice any smells, tastes, tactile sensations on my fingers, sights, sounds, or bodily sensations? Consider any felt sense of an urge, a rising sense of tension prior to the behavior. C is for cognition. Examine your thoughts. Ask yourself, what thoughts do I notice before the behavior? For example, do I sometimes give myself permission? Do I notice specific thoughts or beliefs about the behavior, its consequences, or about hair, skin, or nails? What thoughts or beliefs do I have about my ability to control the behavior? What thoughts or beliefs do I have about slips or relapses? A is for affect. Consider your emotions before the behavior. Do I notice any specific emotions that precede the behavior, such as anxiety, boredom, fatigue, shame, excitement, frustration, or any other feeling? M is for motor habits and awareness. Notice your motor habits and level of awareness before the behavior. In what ways does my body more easily facilitate the behavior? Do I notice postures, hand, arm, or body positions that facilitate the behavior? Do I use my fingers to feel, stroke, or select a target? What is my level of awareness of my pre-BFRB state? P is for place and environment. Consider your environment before the behavior. Is there a particular time of day the behavior is more likely to occur? Where am I just prior to the behavior? Am I alone, with others, or in both settings? Am I engaged in an activity? Are there tweezers or other implements to facilitate the behavior? Do I make use of mirrors? Antecedents prime you for engaging in a BFRB and can influence one another to increase the likelihood of carrying out the behavior too. You then engage in the BFRB. That's the B in ABCs. The behavior is carried out in a sequence of events. There's a search for a target, the behavior itself, and the disposition of the hair, skin, or nails. Lastly, C is for consequences. There are consequences to the behavior that are both short-term and long-term. The short-term consequences are typically positive. For example, it feels good or satisfying. This is called positive reinforcement. Sometimes the behavior makes an unwanted internal experience go away. For example, the behavior relieves an unpleasant urge or emotion or frees you from a thought that was bothering you. This is called negative reinforcement. Positive and negative reinforcement perpetuate the BFRB cycle. After all, we, humans, are creatures of reward, and we're likely to continue to engage in behaviors that make us feel good. Unfortunately, there are long-term consequences too. These are typically negative, such as hair loss, skin lesions, shame or embarrassment, and poor self-esteem. Remember those antecedents? These negative consequences may also perpetuate the cycle if your BFRB is serving the purpose of trying to help you feel better when unwanted and unpleasant cognitions, emotions, and sensations arise. The harder you try to stop this cycle when you experience distress associated with the rising and falling of your antecedents, the further the cycle may be perpetuated. So you found yourself stuck. But you don't have to be. Integrative Behavioral Therapy for BFRBs, IBT, provides a unified treatment utilizing the full range of scientifically supported psychological interventions to maximize and maintain treatment success and move you toward the life you want. IBT integrates the essential components of comprehensive behavioral therapy, COMB, habit reversal training, HRT, acceptance and commitment therapy, ACT, and dialectical behavioral therapy, DBT skills into an individualized treatment plan.
Learn more at the Center for Emotional Health of Greater Philadelphia, where specialized expertise is within your reach. Hope starts here.